Good morning, students. Today we will discuss the topic menstruation. It is a very important topic for both of your theory exams and viva. You should go through the topic thoroughly. We have already discussed the ovarian hormone, so it will be easy to understand you this topic. What is how will you define the term menstruation? Menstruation is defined as it is the visible manifestation of cyclic uterine bleeding due to shedding of endometrium due to the effect of hormone, mainly through hypothalamo-pituitary ovarian axis. Yes, there is visible loss of blood through vagina, and the cycle is the menstruation is cyclic. It repeats every month, and it occurs due to the shedding of endometrium, and the whole event is due to the effect of hormone, ovarian hormone, the estrogen and the progesterone. So it is a natural cycle which occur in human body, and it prepares the uterus for pregnancy. Normally menstrual cycle is of 28 days. The first day of bleeding is considered as day 1 of menstrual cycle. In this figure you can see the bleeding phase is of 4 to 5 days, which is here red color. You can see it is the bleeding phase of menstrual cycle. In this phase you can see initially day 1 to day 14 is follicular phase. On around 14 days there is ovulation, and after that the follicle is transformed into corpus luteum. It is the luteal phase which is under the effect of progesterone. And in this figure also you can see here is the bleeding, shedding of endometrium, bleeding occurring, and it is expelled out through the vagina to the exterior. So few criteria are required for normal menstruation to occur. These criteria are: the first one is the axis must be actively coordinated. Axis means the hypothalamo-pituitary ovarian axis. The hypothalamus must secrete the GnRH, and it must act on pituitary, and pituitary should be responsive to it, and it should release the hormone FSH and LH, and that act on the ovary, and this axis should be coordinated. The next is the endometrium must be responsive to ovarian hormone. The hormones are releasing from the ovary, but these ovaries should act on endometrium, and endometrium should show the proliferation or change in the response of hormone. So it become proliferate under the effect of estrogen and progesterone. And the last is the outflow tract must be patent. So these are the few criteria for menstrual cycle to occur. The outflow tract means the uterine cavity to the cervix to the vagina to the exterior. This tract should be patent. Sometimes it happens that menstruation is occurring but the bleeding is not manifested. It happens in some condition like in septate uterus or any tumor in the uterus which blocks the passage, or in any pathology in vagina. One of important pathology is the imperforate hymen. The cryptomenorrhea term is used when the woman or female menstruate every cycle but bleeding is not manifested. The blood is collected in the uterine cavity. It is not coming out because the hymen is imperforate. In this condition, we will give cruciate incision and make the passage. The condition is called cryptomenorrhea. So, what is menarche and what is menopause? Menarche is the first commencement of menstrual cycle. It occurs around 11 to 15 years. It is the first when the female first menstruate. The age is called menarche. Menopause, it is the permanent cessation of menstruation and it occurs around 45 to 50 years. The normal duration of bleeding phase of the menstruation is around 4 to 5 days, but it can vary. And cycle is around 21 to 35 days long. And average is 28 day cycle, but the range is 21 to 35 day. And what is the amount of blood loss during menstruation? It is around 20 to 80 ml. It is the amount of blood loss. The average loss is around 35 ml. So, what the menstrual discharge contain? The menstrual blood doesn't only contain blood only, but it also contains some other things along with it. Like, obviously, the blood is present, the dark altered venous blood. The mucus from the cervical secretion, uterine secretion, mucus is present along with the discharge. It also can contain vaginal epithelial cell. Some epithelial cells are also present in it, and fragments of endometrium. The endometrium which is shedding inside the uterine cavity is expelled out through the uterine blood to the exterior through vagina. And some enzymes and bacteria are also present. Now, what are the menstrual symptoms? These symptoms are non-specific symptoms and vary person to person. So, these symptoms which appears during the menstruation a few days before menstruation to start, these are breast tenderness, bloating or fluid retention, then muscle ache or body ache. Body ache is present. Joint pain. Joint pain she may complain joint pain, headache, nausea, vomiting, irritability, depression, migraine, mood swing, acne, abdominal cramps. These are menstrual symptoms. Then diarrhea or constipation may complain, lower back pain and disturbed sleep. The most common one are the body ache, stomach ache and depression, mood swing. Obviously, there is fatigue and low energy. So, menstrual symptoms and premenstrual syndromes are two different things. Premenstrual symptoms and syndromes are two different things. So, premenstrual syndromes are disorder of unknown etiology, and it is noticed just prior to menstruation. There is cyclic appearance of large number of symptoms during the last 7 to 10 days of menstrual cycle. So, before categorizing it to premenstrual syndrome, it should fulfill following criteria. Like the symptoms of syndromes. What are the symptoms? Symptoms should be the same as like abdominal bloating, breast tenderness, weight gain, irritability, depression, mood swing, increased appetite, fatigue, tiredness, confusion, headache, anxiety, tension. All these are symptoms. So, these symptoms should not related to any organic lesion. And these are the criterias. And the symptoms should regularly occur during the luteal phase of each ovulatory menstrual cycle. A symptom must be severe enough to disturb the lifestyle of woman, or she requires medical help. Means symptoms are so severe that she requires medical help for it. Or the symptom free period during the rest of cycle. So if these criteria are present, it is categorized as premenstrual syndrome. So before going to the endometrial cycle, we will discuss the endometrium. What is endometrium? Endometrium is the lining epithelium of uterine cavity. So, endometrium, the mucous membrane lining the uterus, which thickens during the menstrual cycle in the preparation of implantation of embryo. Endometrium is the innermost lining of uterine cavity, and it has two layers, basal layer and functional layer. And this endometrium thickens in response to the ovarian hormone to prepare a bed for implantation of embryo. If fertilization doesn't occur, this thickened endometrial layer shed out during each menstrual cycle. So, what are the layers? You can see here. It is uterine artery. It is the myometrium, and it is the basal layer, and here upper part is the functional layer of the endometrium, which undergoes changes. So it has two layers, basal layer, it is the inner layer, and this zone is supplied by the basal arteries. The zone is uninfluenced by hormone, so no cyclic changes are observed. After shedding of superficial part, means functional zone, during the menstruation, the regeneration of all the component occur from this zone, and this measures about 1 millimeter. Next is the functional zone. This zone is above the basal zone, and this zone is under influence of fluctuating ovarian hormone, estrogen and progesterone, and it shows the cyclic changes. And the thickening of functional zone occurs due to the effect of estrogen in first half, and in second half from the progesterone. And functional zone shows that cyclic changes we will discuss it later. It has 4 phases: regenerative phase, proliferative phase, secretory phase, and menstrual phase. If fertilization doesn't occur, the progesterone level becomes low, and the arteries supplying to the blood in the functional layer constrict, and there is ischemia at the base of artery and tissue, and shedding of endometrium occurs and bleeding occurs. You can see here, it is the base, it is myometrium, and it is the basal zone, and here it is the upper part is the functional zone of endometrium. In this figure also you can see lower part is the basal zone and upper part is the functional zone. So endometrium is the innermost lining of the uterus, and its function is to prevent the adhesion between the myometrial wall, and it maintains the patency of uterine cavity, and it provides nutrition to the embryo and form a bed for embryo implantation. Implantation of blastocyst. So we have discussed the embryo. Further we will discuss the other part of the menstrual cycle in the next class. So go through the study material thoroughly. Thank you.